Hello, ladies and gentlemen. Let's talk about Shockwave. Shoulder pain, back pain, neck pain, knee pain. It's probably why you came across this videos. You're having some type of musculoskeletal pain. You're seeing all these ads about Shockwave this wave, that wave, and there's a lot of confusion about that. Part of the confusion is there are devices out there being called Shockwave that don't have a true shockwave. They're not penetrating deep enough into the tissue to do what you're looking for. There are devices that are radial wave. Their depth of penetration is 3 to 4 centimeters. They're great for things like erectile dysfunction, plantar fasciitis. What you need for musculoskeletal stuff like knees, shoulders, low back, ankles, wrists is stuff that can penetrate deeper. Real shockwave devices will penetrate up to like 12 centimeters, which is 3 times the devices that are radial wave, which are fine for wrists or, like I said, erectile dysfunction, plantar fasciitis, those superficial injuries. But if you've got deep knee pain, deep low back pain with some pathology there, a hip, a shoulder, you need a device that penetrates deeper. So when you're looking for an office that does Shockwave, you want to ask about their device, research their device, make sure it has a depth of penetration to get to the body parts you're going to. And the provider should be able to give you some guidance on that when you come in for a consultation. But you don't want to buy a package from a provider that's using a device that isn't adequate for your body part. I've seen advertisements, come in $29 for your introductory visit, and I look at the device and you can buy it on Amazon for $300. The math isn't mathing, as we say. The device we use in our office, we're treating mostly neck, shoulder, low back, hip, ankles, wrist, hands, those type of things. We're not treating erectile dysfunction because that's not what our device is for. We're treating musculoskeletal injuries. Some things you should know about Shockwave is, it works on inflammation. That's the first thing it does, is taper inflammation down. Inflammation goes down, pain gets better. That's your initial response. Usually, you get that response walking out the door with that first, trial treatment. Sometimes it takes a couple days, and I'll tell patients, wait a couple days before you sign up for a package, because I don't want somebody to invest in something that doesn't work for them. Not every modality works for everybody. Some people are better suited by acupuncture. Some are suited better by surgery. Some are suited better by Shockwave. One thing I will say is, as you make a decision going through which device and modality you want to use, do the least invasive first. If you're a candidate for it, I would do Shockwave before surgery. I have patients in my office who have foregone joint replacements because of what Shockwave can do for them. One thing I should tell you, save you some money, is you will see practitioners advertising anywhere from $30 to $60, $70, $100 for an initial visit. Our initial visit is $60. We set it a little bit higher than other practices because we want people coming in who are serious about getting treatment and looking for non-surgical and non-interventional options. But here's the trick. You may go to a practitioner that says $49 for your initial visit, and then when it's time to sign up for a package, they want $3,000 for your knee. And then they're going to turn around and say, oh, and we'll only charge you 50% for the second knee. So you can do the math on that, but the way we do it is just one standard price, and we'll treat up to 3 body areas. So for the same price of the package, you can get, if indicated medically, both knees and a shoulder. Our visits don't expire. So if your knee gets better real quick, you've got some visits in hand. Our visits are non-refundable, but they don't expire, and the reason for that is we want people to go through a treatment program and not stop, halfway through. Usually somebody, just for example, has knee osteoarthritis. We'll say after 5 or 6 visits, that's when the stem cell proliferation and angiogenesis kicks in, and that's when things really start to take off. You're going to feel improvement before then, but it's after that fifth or sixth visit. We generally recommend 2 visits per week, and then we stretch it out there for a course of 10 visits. After that 10 visits, we reassess. What kind of results do we have? Do we need to do another 10 visits at twice a week? Do we just need to go to a maintenance program for every 3 to 4 weeks? And that's where it is. I just want everybody to understand that radial wave, shock wave, there's a lot of confusion. If you go deep into the science, there's also a lot of confusion because a lot of the research is being done on different devices. So it's hard to compare. Like I tell my patients all the time, first thing I did with my Shockwave device was my left knee, and the second thing was the right knee. So I know exactly what it feels like. I know exactly what the results feel like. We're getting, great results with it, particularly with people who come in and do the recommended package. Economics are a factor, not covered by insurance. That's another reason it's not for everybody. That may change, but because it's new, insurance companies call it experimental and don't want to pay for it. And some people say, oh, why does it cost so much? And my response, well, how much is your knee worth? It's worth way more than what we're charging. Why do surgery, weeks of physical therapy for rehab and endure all that pain when you can come in and get a 5-minute treatment twice a week and potentially avoid that surgery for good? Now, don't get me wrong, there's some people who just aren't a candidate for it. They need surgery. But there are a lot of people getting surgery that should do the least invasive thing first. When you do go in to see a Shockwave provider, whether it's our office, another office, because we're in Marietta, Georgia, we don't have any other offices this time, make sure you haven't had any oral or injectable steroid injections, at least 4 to 6 weeks prior, because that's going to work against the therapy. Just to put a little bit more of an advertisement in for our practice, we do offer discounts to veterans here in August. We're doing a Christmas special on our packages until the end of the month, kind of a Christmas and August promotion, for lack of a better term. But, this is kind of a PSA as well as an advertisement. Just research the device that the practitioner is using. Just call them up if you don't see what device they're using, advertise and ask them. Our device at this time, the only one we're using is stem wave. That goes 12 centimeters, whatever body parts you got, we can get the appropriate depth. But I see other practitioners and other devices out there being called Shockwave, and they don't have the depth of penetration when you look at it. And they're not going to help you with low back, hip, shoulder, or knee, depending on the device, because some of them are so superficial. Common sense. If the device is designed for erectile dysfunction, it's probably not the device to use on your shoulder or hip and expect results, just because of the depth of penetration needed. Oh, I forgot my manners. My name is Dr. James Granger, acupuncture injury at Marietta, Georgia. If you have any questions, you can email us at manager@acupunctureinjury.com or call office 678-247-2115. Thanks.